pushing, and there is a penalty marker.
Well, as a defenseless player.
Dante Robinson down as well.
And that was Eagles player Deshaun Jackson getting hit very hard during a football game, and obviously this could be an extremely severe. He actually had a severe concussion, and while your student athletes probably won't be hit as hard, brain injuries can still happen. Here with us this morning is Dr. Joe McGinley, a radiologist at Casper Medical Imaging. Thank you so much for being here this morning.
Thank you, Brittany. It's great to be here. As you saw in that video clip, that was a really hard hit. I mean, that player, he didn't see that coming, and helmet came in, hit him pretty hard. And what happens in these type of injuries is they have a helmet on, but they're not completely safe. Your brain actually floats in your skull, and when these impacts occur, the brain bounces around in the skull and hits off the skull both in the front and back. And that's what really leads to these type of injuries or concussions.
And you have an animation here that explains that. Can you go through this and explain what's happening?
Yeah, basically in this animation it's showing how the brain is not actually fixed in the skull. And when somebody gets hit, the skull tilts to the side or tilts forward, and the brain is floating in the fluid in the skull and hits off the front and then rebounds and hits off the back again. So you're seeing the initial impact, and then you're seeing the brain rebound and hit off the back of the skull. So you can get injuries in multiple areas. And
so what would some symptoms be of having a brain injury of some sort?
Yeah, with these, the symptoms can vary greatly based on the severity of the injury, the severity of the hit. Some mild symptoms can be just confusion or headache. You may not even lose consciousness. In the hit you saw there, the football player Deshaun Jackson, he actually lost consciousness for several minutes on the field before they were able to get him off the field. But you know, symptoms can be dizziness, any type of changes in their mental function. They can be disoriented. So yeah, the symptoms vary greatly based on how hard the person was actually hit.
And we've heard stories of former professional athletes actually committing suicide or killing others because of these injuries. I mean, how does this happen? I mean, should we be worried about our young athletes?
Yeah, so over time, if you have repeated injuries, repeated concussions, repeated blows to the head, this adds up. So when this occurs, it's not just one fixed event. There's some cells that are damaged in the brain, and after multiple injuries, there's large areas of cell damage. This can lead to basically symptoms of dementia or Parkinsonism, and in these patients, they really lose a lot of mental function. Even at an early age, it can lead to depression, which ultimately can lead to suicide or committing acts that they typically would not do.
All right, well, definitely got to be careful when you're out on the field, and keep that in mind. Thank you so much for being here this morning.
Thank you.
All right, well, we'll be right back after this. Stay with us.